Hi, everyone, and thank you for joining our global panel discussion on COVID-19 responses in vulnerable urban contexts. Before I hand it off to Nels Nelson to start our panel discussion, I would like to go over a few items. Please note that all attendees will be on mute for the duration of the presentation. If you have a question, please enter it in the questions box on your webinar dashboard. Questions will be answered at the end of the presentation in the order in which they were received. This webinar is being recorded and will be provided to attendees along with a certificate for your records in an email after the webinar. I will now turn it over to Nels to start our session.
Hi, everybody. Thank you for joining. I'm a planner with Stantec's Urban Places. We're a group within our company that are focused on the future of cities. The discussion that led to this webinar started as an idea between the panelist, Sam Sternin, and myself. Sam is a behavior change expert who has been consulting with the Gates Foundation and the Gavi Vaccine Alliance, and now more recently also with the Bernard Van Leer Foundation, working with cities on issues related to children ranging from ages 0 to 5. Back in 2018, Sam and I wrote a piece about the threat of infectious diseases to urban resilience for CityLab, and how infectious diseases are still a relevant concern for all cities, regardless of their income status. So we were thinking about writing a follow-up article, but instead decided that it would make more sense to get some people together to talk about this emerging issue as things continue to change. We'd also like to thank Stantec for hosting this discussion and all of you for joining today. So I can introduce our panel. I already mentioned Sam, who's joining us from Vietnam. I'm in Amsterdam at the moment. Unfortunately, in the last hour, a couple of our panelists who were listed from southern cities, Gautam Bon and Alan Kane, have had to step away for family health emergencies. This is the reality of the situation that we're talking about. Alan Kane is a professional planner in Angola, and Bantam was an academic, or still is an academic in India, in Bangalore. Alan might join us later, but we're going to continue with who we have. We do have on the line Dan Rivera, the mayor of Lawrence, Massachusetts, a city with more than 80,000 residents. Dan has led the city through multiple crises, including the gas emergency and now through COVID. And he's been very successful in adopting strict policies, even ahead of when the state required them. Despite that, Lawrence is a vulnerable urban context and currently has one of the highest infection rates in the state. And lastly, we have Godlin Mindra, who is representing the intergovernmental organization UNICEF. He's an urban health expert and previously was with CDC and the WHO. So thank you to all the panelists, and I'll be the sole moderator, facilitator for this discussion. We're going to jump in and just talk a little bit about setting the stage and the topic and the issue that we're discussing today, and then I'm going to ask 4 questions to the panelists. They'll have a chance to respond, and also as we're going, please feel free to write in some of your audience questions, and then we're going to save the last half hour at the end to answering questions from the audience. So the discussion today is about the pandemic in vulnerable urban contexts. So, there are a lot of drivers to vulnerability. There's a lot of different stresses on urban resilience, such as unemployment, climate change, governance failures, involuntary migration, unemployment, and most recently, the increased threat of infectious disease. Vulnerable urban contexts are also where millions of people currently live, and which are projected to grow by hundreds of millions as the world continues to urbanize. So it's an important context to think about. In the last half year or more, there have been so many discussions about the impact of COVID-19 on cities. Stantec has produced some really good materials about that, which I've helped author. There's been an outpouring of blog posts, other articles, interest, discussion, webinars, and that's been a good thing. It's been really interesting to think about cities afresh now that we're dealing with this. And COVID-19 has really led us to reimagine how we're planning and designing and thinking about the future of cities. Much of these discussions, and indeed a lot of the early actions, such as reclaiming streets, creating social spaces, have been in wealthy cities like Boston and Amsterdam. To reinforce those differences, I was looking recently at some data that was published by Google on its from its location services, which kind of painted a picture of how people are moving differently from, let's say, the baseline context in different cities. Where I'm sitting in Amsterdam, there's about 50% fewer trips to retail, workplaces in transit, meaning more people have the opportunity or things have changed so they can work from home, buy things from home, not take transit. In Lawrence, where the mayor is, transit and workplace trips are only down by about 25%. So, but park use has almost doubled. So there's been some different patterns in how things have gone with the pandemic. In Luanda, where Alan Kane is, only transit has been pushed downwards, whereas working retail and even grocery shopping are kind of where they were before. And finally, in Ho Chi Minh City, where Sam is sitting, more people are going to work than ever and spending less time at home because their community case count is at 0. So very different contexts, and we're going to talk about how different things are going in these cities. There's been a lot of experiments, but what we found is that we haven't heard as much from the vulnerable urban contexts or contexts where people were already vulnerable before the infectious disease came. So this is the kind of the framing of the panel. How does the pandemic affect vulnerable urban contexts where millions of people currently live? How are these contexts being refashioned, and how might they be reimagined? So we're going to start with topic 1. And again, as you're listening, feel free to chime in or write your audience questions, and we'll get to those. So the first topic is, what has been the most surprising thing you've learned as you've witnessed cities seeking to respond to the COVID-19 pandemic that supports marginalized and vulnerable urban populations in particular? And we'll start with the mayor, and then Dr. Godwin, and finally Sam.
Well, good morning, Nels. Thanks for having me, and I'm excited about this conversation. I think that the biggest surprise for us, we're a small municipality in a medium-sized state in the United States, and the importance of local institutions has never been greater. That surprised me in the sense that we pay federal and state taxes, and we have all these huge national institutions. But if it weren't for having a very stable and a well-run local hospital, if it wasn't for having a very stable and local, well-run community health center, the school system being healthy and in a good run effectively with good staff, and even the municipal government being in a place where that it had enough local resources, financial resources. It was very surprising that we had to kind of rely on our own, not because help wasn't coming. It's just that it takes a long time for help to come, and so we spent $1 million of our own money to get people tested for COVID, to stood up our own thing. Now then, the insurance companies caught up and the state caught up, and so now we have to spend less on that. We had to stand up our own food pantries before the state and the federal government kind of got on their way. And we actually bought laptops for our kids to get to school. So the importance of having local institutions that are healthy in this crisis, especially when we rely so much on institutions. In some communities, you don't rely on institutions at all. But in a poor community where people are like, where do I go to get help, is the #1 question people ask. If you don't have a place to send them, You say, well, we're waiting to see what the state's going to do, or we're going to wait to see what the federal government's going to do. As you could tell, they haven't passed, a new set of supports from the federal government because of politics. So for us, we can't help. We got to have a food bank every day, and we have to have COVID testing every day. So the local institutions have been very important.
Yeah, thank you for that community-driven message. Godwin?
So thank you, Nils, for introducing and for bringing this topic forward. So COVID, I mean, its effect has affected both the well-to-do and the poorest communities. And our concern has for a long time been the disadvantaged communities in urban areas. And we have seen, in various contexts, how the effect of COVID has been responded to in leaps and bounds. In some instances, good responses, and I must acknowledge those, and those have been forthcoming. One of them could be, that I could not think about in tropical sub-Saharan countries, where you would think that the plight of urban poor communities are not thought of. We've seen governments responding with opening channels for these communities who are all self-sustaining. They have to go out there and earn for themselves, but they've given them the opportunity to continue transactions and earn a living remotely, even when those restrictive lockdowns were in place. You would imagine if someone earns on a per day income, they have to go out there and earn for themselves, and you lock them down in their houses, their livelihoods just disappear in thin air. But giving them the opportunity to continue transactions using mobile telephones, even giving subsidies, some to communities that have organized structures. We've seen those in Nairobi. We've seen to some extent opening up of roads for specific poor communities to be able to transport goods within structures in Uganda. We've seen in Angola, where they have leveraged the existence of community structures in urban areas to reach those poor communities that are most affected by COVID. I think those are good practices that at one point one would not think of, because there was a bit of this ear being given to the plight of these communities, and I think those governments must be applauded for that. But still, we continue to see some indifference in some countries where the plight of these communities are glaring, especially here we're talking about the urban poor communities. We still don't see interest being paid to their needs. We've seen people locked down regardless of whether their needs, basic needs, here I'm talking about basic needs, clean water. Do they have access to even shelter, especially for the street kids and street families? Those have not been responded to. We've seen some draconian measures being taken with police at inlets and outlets of urban poor communities, especially those in slums. We've seen that in India. We've seen it in Peru, Southern America. So it's varied. But it surprises, yes, but I think COVID has brought to the foreground, the vulnerabilities in these communities, the need for us to begin paying attention to some inherent risks that we have in urban areas that if we do not address, it's not only going to be those urban poor communities that will be vulnerable, but it will eventually come to the doorstep of everyone who lives in cities.
Yeah, that's a good point. Finally, Sam.
Yeah, thanks again for the answers we've already heard. I think for me, there have been a couple of surprising things. I think the first thing is building a little bit on Godwin's point. I was surprised that the health impacts, by and large, seem to have been better managed than I would have expected. So, as you know, Nels, in the lead up to this, we've had a lot of warning signs. So before COVID came along, we had record numbers of cases of measles. We had a number of outbreaks of other vaccine preventable diseases happening all around the world. So we had a sense that the health systems were not doing well, that preventive health and basic public health measures were really kind of rickety and fragile in a number of different countries all around the world. And that's, I think, both in wealthy countries and in lower income countries. But a lot of times these epidemics end up hitting the lower income communities wherever they are. And so when this first kind of emerged, I think a lot of people were thinking, when this hits Dharavi, the famous slum outside of Mumbai, when this hits Kinshasa, when this hits, some of these mega cities where we know there's high concentrations of people living in very close spaces with, minimal access to social distancing, water, sanitation, and hygiene. I think there were predictions and visions amongst many of us, particularly in the public health community. We thought this was going to be devastating. I don't want to say it hasn't been devastating. It has been devastating for many communities, and there have been certain cities that we can think of which have been particularly hard hit. And so I don't want to minimize that. And I think particularly in a couple of countries in Latin America, there have been certain cities that have really been badly hit. Obviously, we know about Northern Italy. We know about various cities in the wealthy world as well. But the anticipated disaster, when this hit the Rohingya refugee camps, when this was going to hit the refugee camps in Greece, for example, I think many of us thought this was going to just be a public health complete, much worse than it has ended up being. So on the one hand, despite the many challenges and the terrible public health impacts we've seen, overall, I think we've in some ways done surprisingly well there. What maybe was more of a surprise was how poorly so many places have done on mitigating the economic impacts of this. And so I think many of you may have seen, the World Bank estimates, and this is from 2-3 months ago. This was before we knew that the second wave was really coming, and we're about to hit that second wave in many places, and it's looking like it may be even worse than the first wave. But already as we were in the first wave, the World Bank was saying we probably have lost the last 10 years of poverty reduction. So if we look at the number of people in poverty around the globe, we've just turned the clock back minimum 10 years. And so I think what's been really surprising to me has been to see how much we've struggled to provide assistance and to get assistance to the vulnerable people who need it the most. And actually, there's been a pretty huge policy response. There's a great World Bank paper that actually lists all of the different policies that different countries, states, and cities have introduced. And providing extra sick leave, providing cash transfers, providing access to school meals for kids who aren't in school, adding protections so that people don't lose their jobs, or furlough schemes. There's actually been a huge range of a really amazing policy response to this. But many cities have actually found out that they didn't have a way to channel that support to the lowest income people, which is pretty surprising to me. I mean, to be honest with you, we're in 2020. Even in the most disadvantaged countries, the urban poor all have phones. They could be accessing mobile money. We have ways of reaching them. There should be mechanisms that allow us to channel the support. But we read time and time again every day, there's a newspaper article about this fund or that fund where the funds have been allocated, but they haven't actually been spent because we struggle to get those funds to actually down to the level of communities, individuals who need it. And so I think it is kind of interesting to see how tough it's been. There are some cities that have really risen to the occasion, and I think just hearing Mayor Rivera's intro, you already get a sense that the city of Lawrence is a city that has been really proactive and has been thinking about the most vulnerable members of that city up front, right front and center from the beginning of this response, which is great. But there have been other cities that just haven't had that focus and haven't managed to do that. So I think that's been an unfortunate surprise, and maybe tells us a little bit about the fragility. I think a lot of us have felt that urbanization has been a very powerful force for good and for poverty reduction, over the last 15, 20 years. And I think that's true. But I think that perhaps a lot of people miss the fact that many of the people who escaped from poverty, they didn't get that far above the poverty line. You know, they maybe just made it out of poverty. They were just getting by. Things were going okay. But faced with any shock, we see how many of them have now kind of fallen back under that poverty line and really struggling to make ends meet, whether that's someone who's, you know, struggling with basic necessities in sub-Saharan Africa and South Asia and South America, but even in our wealthy countries, even in cities like Lawrence, people are really struggling to access basic services, to stay in their homes, to make ends meet. And I think that is if we didn't have it before, that's a wake-up call, I think, for all of us in the urban planning and management and design community to be questioning what kind of cities have we been building, and I think it's great to have this discussion about how maybe we should be thinking of doing things differently as we move forward.
Thank you for that, Sam. The discussion of livelihoods and economic impact seems to be a common theme. I also wanted to share, because we had a chance to catch up with Alan before the panel, and he said that the surprising thing from his context was that while they had been experiencing really fast migration into cities, with the pandemic, they've actually started seeing some migration back out of the city, and that seems to, be part and parcel with some of the economic impacts that are being discussed, and maybe that's how this is affecting migration to and from cities. Maybe it's something we could come back to. So I'm going to jump to the next question. The next topic is, many people have said COVID-19 is an opportunity to reimagine cities. What does that look like from your perspective and from the perspective of marginalized people in your city? What transferable lessons learned, if any, resulted from these communities' experiences? And I think we'll just go in the same order, so I can pass it back to you, Mr. Mayor.
Thank you. I think the very first one, and it's the one that everybody sees, it's the taking back of our streets and our public ways. To have said that I was going to take 10 parking spots and turn it over for seating in a restaurant last July, I think they would have burned me at the stake. It's just one of those things that parking has become such a thing that we won't say that healthcare is a human right, but people think parking is a human right. And so it's crazy. We have whole systems around parking, and instantaneously we took back these spaces and made them public spaces in the essence of it, because people are restaurants didn't even fight over the space. They were just co-sharing these spaces together, and everyone loves it. No one wants it to go back to the old way, because it shows a more vibrant, livable community. It's funny because there's all this construction happening, and all these people in real estate are trying to create spaces that are work, live, play, and surprise, our cities are already places where you can work, live, and play. And taking back those spaces emphasize it. It's a huge opportunity not to go back in that way. And I think there was already a movement to bus rapid transit, to take back some of those spaces, to make transportation more available to people. That's been huge. I think you're going to get, especially for the marginalized workers, that their work is actually essential. You imagine that before I would tell you the guy who bags your groceries is an essential worker? You would have thought, that doesn't make any sense to me. But those people who are working in the grocery stores, those people who are working in food manufacturing places, and it's funny, some of the least paid people ended up being some of the most essential people. And for us, that's immensely important when we're trying to fight for $15 an hour. It really should be $20 an hour. And surprise, the healthcare workers, it's not just doctors, nurses, and x-ray technicians. It's people who are providing healthcare for people in their homes, people providing for adults with disabilities. All those people had to go to work. And then everybody got to see who they were. I think that's very important. And I'm hoping that we don't go back to a place that they become invisible again. That's a very important piece of it. I think education is going to be revolutionized. Forget about I'm not even talking about college and university where everybody's doing it remotely. I might have struggled with it. I'm a visual learner, so I need to be in the space and, you know, and emote when I'm learning. But apparently it's going great. But education K through 12, we have shut down our schools, but we're trying to get kids to learn remotely. But I'm telling you that we're not going to be able to catch up. And if you have money in this situation, you're going to be just fine. They're creating education bubbles, and people who can't go to school full time are doing it in their neighborhoods if they have the money to do it, or they're sending their kids to parochial school. So these things in education is going to be turned upside down because those kids who couldn't do those through this pandemic are going to be behind in a way that they were already behind institutionally. Now they're going to be behind further. So I think, and I'm going to start pushing for this, is a school year that's 365 days. I think we're going to have to go back to a situation where if we're going to go back into the classroom to get these kids caught up, we have to have for at least 2 or 3 years a 365-day calendar to help. So I think you're going to see a different education landscape. And the final one, I think this is for us, for people who are fighting the housing crisis in our communities, where the rents are too high, and you can't find a house to buy in the neighborhood you grew up in. All these things, when people are deciding they're not going to go back to commercial spaces, think about a 25-story building, 30-story building, and that the businesses have saved so much money on utilities, on rents. They're not going to want to spend that money again. So those places might end up being empty. Pivot to changing those places to housing. It's going to feel weird because everybody used to walk into, let's say, the Prudential Center in Boston to do business or to do commerce. But if you gave half of those floors to housing, and you gave half to affordable housing, immediately you have this mixed-use housing development, and people can live in Boston and downtown. People, well, what about commerce? Well, those people got to buy stuff someplace. They got to buy food someplace. They got to eat. They got to bring their car to get fixed. All those, I think commerce will be flat. It might be different places that grow and slow down. But what we won't have is what's happening right now, which is businesses are closing. I don't think you'll have that. I think you'll have a robust commercial mix. So when this thing happened, the first thing was taking back our spaces. And I think the next thing is going to be trying to figure out, these places that are going to be empty because folks aren't going to want to go back to commercial spaces. Can we use it for housing? And how we attack the education, gap that's going to be there for kids who couldn't make it to Zoom or didn't have the technology to do that. That's going to be an important part. And in the end, we should never forget who was essential, especially when they're doing the vaccines. They're going to want to change the list of essential people when they're doing the vaccines. But I think you got to stay focused on the fact that these people who we paid the least amount of money who to feed and put food on our table are the ones who are working every day. Pay them more and make sure that we don't forget they were essential.
Yeah, thank you, Mayor, for those really, really excellent points. It is, a lot of this behavior change would be unthinkable before the pandemic. Getting rid of parking, year-round learning, treating essential workers like the essential workers they are. It's been a big change. So thank you for highlighting those. Godwin?
Thank you. Thanks, Neil, and thanks, Dan, for highlighting some of those important aspects of what we should do differently. So urban areas have been for a long time, or cities have been a beacon of hope for populace. People move into urban areas because it's time to change their lifestyle, livelihood, get better education, better health, and so on. But it's not true for everyone who goes into urban areas. Some of them fall through the cracks, and in large part, it's for those who are engaged in informal sector, those who move into urban poor neighborhoods. They live in crowded areas, and they don't have access to land tenure. They are always segregated or discriminated or not considered as priority during planning or prioritization in various things. So COVID again has shed light on most of these risks or vulnerabilities in urban areas. We have seen, all of you probably have seen the image of Mumbai before and after COVID in terms of pollution. That clearly highlights the risk. If you have pollution, respiratory diseases are going to be prevalent, and now with COVID, it just makes the picture worse. So people who have airway or respiratory diseases are likely to succumb to COVID faster. So that has rightly put urban areas in the focus, that we have to address the risks of pollution if we are to improve the health of population. The other thing we will have to think about is rethink the structuring of health from just being hospital centric. It's common that in urban areas people think about hospitals, more high tech healthcare delivery instead of the basic primary healthcare, which provides services that will prevent diseases and are accessible at low cost and closer to the communities. If we don't go back to those basics, and usually when we talk about primary health care, people are, this is for remote areas, it's low tech, it's not for urban. When we talk about healthcare in urban areas, it's those shiny stuff. Well, COVID has shown us that that's not the case. We have to go back to basics. If we want to spread healthcare services across the board and make it accessible to people, let's go to those that are low tech, preventive, and accessible. And there we would achieve the goal of universal health coverage. The other thing is COVID has brought to us, the idea to look at urban areas as even intra-urban, because in the past we looked at urban areas as one block, so health outcomes in urban areas are better, including for other sectors, whether it's education, enrollment, access to clean water, security, and so on, because it's the few who have access to this that really make it to the top, and it's that data that is captured. But now, if we disaggregate, we see that certain areas in urban locations are vulnerable. So we will have to prioritize those. And COVID couldn't have made it clearer, So we have to look at urban areas as different neighborhoods and look at their risk profiles in that way. Participatory element into urban service delivery, whether it's planning, there's a sense that we will have certain parts of the community participate in planning, implementation, and monitoring of services. But for those who are in slums and so on, they're considered not legitimate, so they're not part of the plan. They're left out. So here, and with COVID coming in, we've seen that those communities are the ones who are hit hard. Mortalities are high there, morbidity, case number to infection rates are high in those communities because, they have all those risk profiles that we did mention earlier on. So we'll have to bring those to the discussion table. What can we do to address their needs? What can we do to address their vulnerabilities? We have seen that in countries like Ethiopia that rolled out a successful measles campaign. It's not that they did it the way it should have been done, what they would have done in 2018 or 17, but they had to rethink the way they planned their measles campaign, including in urban areas. Smaller sessions brought in the use of PPEs for health workers who are delivering this, even for those who are going during social mobilization, social distancing, and all those. Those were ingrained into the planning and implementation of the campaign that eventually delivered intra-COVID pandemic. So those tweaks and understanding that we have those risks in urban areas will help us deliver programs that address the needs of those who are vulnerable. Now, when we talk about partnerships in urban areas, those are critical. We are tuned to, going to our traditional partners. Those are our folks that we are used to, we're comfortable with. So if I am from the health sector, I'll go to the Ministry of Health because those are the guys who speak my language. But now we realize that, yes, with COVID, everyone counts. Every partner counts, including that caretaker who is coming from Islam, including the private sector who is out, the private provider who is out there to deliver service to a small community. By the way, he or she knows the needs of that community better than anybody who is in there. We usually don't engage local government. We don't engage. The mayor is here. We will bypass them because they don't speak our language. But I tell you what, these are the guys who hold the power to even the meager resources they have. He talked about repurposing $1 million of their own resources. Where would you get that from if you didn't bring him to the round table? You want to have frontline cadres identified who will help you in championing delivery of messages into communities. Those would not traditionally be experts in health. They are local community members. They are known better by maybe quartermasters and so on. It's only the local government guys who would know them. The private sector might bring for you new technologies. We'll send them produce test kits and so on. We need to engage them. In Pakistan, in Karachi, one of the things that they did in urban areas is to use private facilities as extra spots for vaccination, for outreach deliveries, because they needed to expand. And if you want to expand your services, make it more closer and smaller, you need more points, right? And the public facilities cannot do that. So you look at the private, you map them out and see, okay, who would like to use this space for this? So that collaboration came into focus, and it's working well for them. So that partnership will eventually need to be explored, and data. We cannot, deliver, we cannot respond to the needs of communities, we cannot identify where our blind spots for the program are if we don't have data and data. Right now, we're looking at the effects of COVID on service delivery in countries, but most of the data we have is for national, level. It's not specific to whether this is urban or not urban. So next thing we'll probably have to look at is for urban areas, look at, how has services been affected by COVID? We know that COVID has had a brunt on urban areas, but we cannot tell how much there has been. So probably refining our data, fine-tuning it, pointing more into the vulnerabilities in urban areas. We will come out with information that will be able to inform our programming, tweak it more, and deliver it specific to the needs of communities who are in urban.
Yeah, good points, Godwin. It's interesting to hear how you're treating cities as more differentiated as a result of this pandemic, and also the points about treating health as more of an environmental issue resonates with me as an urban planner, because you can really see that pollution, but also other factors of how the services are provided and the structure of the city can actually inform health impacts. All right, so finally over to Sam on this topic.
Sure. I mean, I think my co-panelists have made a bunch of great points, so I'll maybe just add a couple more and build on that. So I think transport is an area that a lot of people have talked about, right? We've cities introducing bike lanes, people talking about how do we keep public transport alive, but in a way that allows for safe social distancing. And it's not just about COVID, because COVID is now, but other potential diseases and threats that could come. People talking about moving away from car-based transport, both from an environmental, climate change resiliency perspective, but also from a quality of life perspective. So I think all of that is great. But when I look at the urban poor in Lima, or the urban poor in Nairobi, you know what? In so many cities around the world, when you're poor, what your day involves is you're waking up at 4:30 in the morning, getting your kids ready, saying goodbye to your kids or whatever, and then you go and you get on a minibus. And you get on a minibus and you sit in that minibus for many hours. Maybe it's public and private mixed, a matatu, a minibus, a bus, but the urban poor are locked into these legacy and not good transport systems that take hours and hours of their life away, and have huge costs. And I don't see, like, it's great to bring in bicycle lanes and to think about other things, but I really think that as we're doing that, we got to make sure that we're also providing good alternatives for the working poor who may not have the luxury to walk to work, or to walk to their kids' school, or to cycle to the different places that they need to go for their livelihoods. And particularly in some cities in the developing world, there's been a little bit of a negative trend of saying, you know what, we want to make the streets so nice for cyclists, so let's get all these street vendors and all these market people who are on the street and all these messy urban poor people out of the way so that we can have nice clean streets for cycling and stuff like that. And that's where I really think we need to be really careful as we're reimagining mobility and transport, which is awesome. Let's do it in a way that empowers the urban poor, that reduces their transit times, that doesn't increase their transit times, that gives them, so that they can wait and spend more times with their families and less times, stuck in terrible traffic, terrible pollution. So transport is an area, there's been so many great discussions, ideas, and pilots going on in cities, but let's not do this in a way that, again, is at the expense of the urban poor who may not have a choice. They can't work from home, right? They can't just sit at a computer like many of us can and have that luxury of doing that. They have to get on that bus. They have to go out and get to work and all of that. Same thing with public spaces. So there's been great innovation around parklets, taking parking spots and turning them into public spaces, shutting down roads so that they become pedestrian only, so that we have public spaces, especially if people don't have access, or are under health restrictions that mean they can't go further, within a certain perimeter around their homes. A lot of countries have introduced that during various lockdown phases where people could have to stay in their own neighborhoods, that kind of thing. So again, that creativity is great, but I can tell you that I don't see that much of that happening in the favelas. I don't see that much of that happening in the slums in sub-Saharan Africa. So there's a lot of these great initiatives, and they are, by the way, happening in wealthy and in less wealthy countries. So even in some very low-income countries, the nice, rich areas of cities are developing new parks and new public spaces. It's great, but we gotta be thinking about providing access to those types of spaces to everybody, because it's fine to have a beautiful park somewhere for the wealthy people, so that when they're kind of under lockdown, they have a place to go walk their dogs and whatever. There's nothing wrong with that. That's great, but we've got to find creative ways so that even people who live 5 kilometers from the nearest park, there's no way they're going to go to that park. Can we find ways to take some public spaces, whether it's parking areas or streets or something, in and around where they're living, and invest in them, whether that's permanent kind of hard infrastructure investments or just a soft measure like closing the street and organizing creating space for community events or whatever. But I really think this great revolution in public space is a wonderful thing, but for now it's so concentrated in the wealthy areas, and it's not yet, with a few exceptions, very few exceptions, it hasn't reached the marginalized and vulnerable communities who really could benefit the most from those amenities. I mean, the livelihoods piece, it is just, you cannot ignore the fact that when the Indian national government, and this was a national government decision, this was not a city decision, but when they declared a lockdown with like 4 hours notice, and tens of millions of people faced with that had no other option but literally pick up their stuff and start walking and going somewhere else, because they knew they could not survive. Their livelihoods would not permit them to survive in the city for more than X number of days without an income. I think, and India was the most visible of those cases. But look, I live in Ho Chi Minh City. Vietnam has been one of the most successful countries with coronavirus, and we're very lucky right now. We don't have any community transmission, so everything is open for business as normal. But when we did have a couple of waves and we had one kind of lockdown period, a lot of people actually had to leave the big cities and go back home, because it just wasn't economically viable. And if the factories closed and if their livelihoods closed, they weren't able to stay in the city. They had to go back to the countryside or back to the smaller cities. So I think that again points to the fact that our cities, and I'm not even going to say, but if we think about the next 50 years, There are going to be hundreds of millions of new urban dwellers. A lot of them are going to be in sub-Saharan Africa and South Asia. But we've got to find, even Mayor Rivera was talking about $15 minimum wage and saying, even in a wealthy country such as the US, when you're in a low-income community, so many people's livelihoods are so fragile. And it's exactly these essential people who we never realized how essential they were, and now we know how essential they were, who are often at the bottom of the pay scale. So I do think that as we're thinking about, it's great to think about environmentally resilient cities. It's great to think about smart cities, tech cities. We have these movements, I think, in the urban sphere where there's these catchy phrases that everyone wants to be this city, a smart, green, eco, whatever city. That's great, but Godwin said something about getting back to basics. Surely one of the basics of a city is that a city provides living wage jobs where people can afford to live a reasonable life, take care of their kids, not be at the mercy of any health shock or economic shock that could come, and not face the prospect of losing their house or having to move somewhere else or something like that. I think thinking about those basic kind of good jobs, right, that provide livelihoods, but then there's the social safety net piece, and that's what I'm going to end on, and just to kind of reinforce what Godwin has said. So many cities around the world in different ways have found themselves struggling, even when they had resources available, to identify and get those resources to the right people, because we have the most up-to-date data about certain things in our cities, instantaneous data about financial transactions, about a lot of cities now have great traffic data. Google Maps will tell you exactly how many minutes it'll take from this place to this place. We have great data on those kinds of things. But so many cities realized that they had no data to tell them where were the most vulnerable people living, and how could we transfer things, whether that was transferring money or whether it was transferring in-kind support, food or whatever. So many cities have struggled because we realize that we don't have the data. So I've got to believe that with technology, big data, AI, with remote sensing, with all of these tools that we have that we're applying to so many other things, there have got to be ways, as we're thinking about reimagining our cities, that we can use these tools to create a stronger safety net. And so that if the national government or state government or city government allocates resources, we can get those to the right people quickly and effectively. I'm going to stop there.
Can I add something?
Sure.
You move, and the cool thing that what we've noticed, how little it takes to make people's lives better. We did, we had the added unemployment benefit here for a long time, and I think it was $600. It made people rich who had been poor. I'm exaggerating a little bit that it made people rich, but we didn't have. Somebody called me and said your unemployment is 23%, 25%. Are you seeing like these? I was like, no, people. The safety net worked, and it took us so little of our total GDP. It took us so little to make people's lives a little bit better. And I'm hoping everyone, all the policymakers, can say, well, listen, we were fighting before because we didn't want a socialist state, but honestly, 20, 10, 15 bucks an hour will make everybody's life better. Let's just do that. Providing so it takes so little to make everyone's life a little, significantly better. I think that was another one of these things you see. Hopefully, that's another thing. You don't have to convince people so much that you're going to help somebody with just a little bit of resources.
Yeah, really good points all around. Leaning on the saying, no child left behind, what this conversation made me think about is no neighborhood left behind, because access to healthcare, clean air, transit, open space, adequate housing are critical, not just in the rich places, but also in the marginalized places. And those might actually be the places where we should invest first, because of how important they are to our cities, to keeping them running. As the mayor pointed out, and Godwin pointed out, that could be it doesn't need to be a brand new big shiny hospital. It could be tertiary services that get out there, primary services that get out there at the community level. So we're going to go to the third topic and then have kind of a lightning round of the fourth topic, and then get to the other questions from the audience. Okay, so the third one, does the pandemic drive us toward more incremental change due to the potential downsides of risk and competing priorities for limited resources? Or is this an opportunity for radical urban transformations? And we'll start with the mayor again.
I'm going to be a pessimist on this one. I apologize ahead of that. I think as it pertains to the COVID outbreak, yes. So people are telehealth is the biggest example of that. People said, no, I need to go see my doctor. I need my doctor to see me. The moment you told them, well, if you go see a doctor, you might get a very vicious disease and die. They said, oh, well, I'll talk to him on the phone. I'll Zoom with them. And so the acceptance of it, because it helps with the virus, I think it was very important. Like, so people have this inverse thing to it. So if it's a heavy lift for me, but it keeps me safe, then I think that they're going to have that adoption. But if it doesn't really matter, if it doesn't, I don't want to change that. We're having a fight about Halloween. People want to do Halloween. I'm like, but you don't understand. You're still going to get the virus. It's like, you can transmit, because they don't want to change that. I want to come into City Hall and do X, Y, and Z when they can do it online. But as long as these radical changes, radical urban transformations help with the virus, I think we should absolutely, I think everybody's open to it. But if it's not related to the virus, transportation is actually the biggest one that's going to have a problem making headway. Because if I can wear my mask and everybody is hand sanitizing and distancing, why not just add more cars to the trains? Or make them run more often so that we can get everybody through. As opposed to saying, well, why don't we go up on the street and big guy like me should probably not be talking, but take a bike or figure out a way to bus the mass transit. It's a hard lift for people to understand. It's easy to understand the transformation when they can see immediately how they're going to make their lives better. Otherwise, policymakers are going to be hard pressed to make a case to radicalize stuff. And I'm thinking about, telehealth was one. The food, buying food by calling and getting food delivered. Why go get my beautiful steak that I love, or my sushi or something like that, when I can call and have it delivered? No one would ever do that. They want to have the social experience of doing those things. And I know that's kind of like a first world problem, but people would never order that food online to have it delivered. So that's a big change for us here. Not as often as has been happening now. But I think the biggest one next to the telehealth stuff is the political opportunity for transformation. That we can do vote by mail is a huge thing here. It was never in Massachusetts, which is a big blue state, very big D Democratic. It was always one day, and if you wanted to vote early, you had to do an absentee ballot, and the rule was you had to be out of the city that day. So if you did an absentee ballot, you had to be out of the city, or sick, or something that prevented you from showing up to the polls. We are about to pass the total number of people that voted in the last mayoral election, about 17,000 people. Between the people who voted early, downstairs in person, coming in the last week, and people who mailed in their ballots. That is a huge thing. The facilitation of democracy through mail, through early voting, that it doesn't have to be one day in November that you vote. I think that helps marginalized communities a bit. People just walking by, they're like, oh, I can vote right now? Oh, I'll just go vote. They're going to work, they're coming back from a doctor's appointment. Having to run a lot of campaigns, trying to get the most amount of people through that 12-hour, that 8-hour window to go vote is an incredibly hard thing to do for marginalized communities, because we're working third shift for first shift, early first shift. I got to pick up the kids. So there's 100. If it rains, nobody wants to do it. This, I think, is going to be the biggest impact for us, is this political ability to enfranchise those people who've been, for all intents and purposes, disenfranchised, by the strict rules of election. So I don't think people are going to be willing to do it. And again, the only reason people are mailing in their ballots is because they don't want to show up. They're afraid to get sick. And so if I had said to them, "Well, we're just going to just do it," people would be like, "Why? I'm going to go show up and vote." But now they're doing it because, again, the inverse pyramid. The more it helps with the COVID-19 and keeping people safe, the more open they will be to it. The less it does, the more fighting you're going to have. And I hate to be a pessimist on that, but I know the hearts of voters. They're just not, you know. And it's unfortunate. I think that I think some of these really bad, seeing Australia burning with the kangaroo in the foreground, seeing Los Angeles burning, seeing the icebergs falling apart was not enough. People just, that's so far from me. But when we have a winter storm, a blizzard, and we have 5 blizzards in one season, people take note of that. So they'll be more willing to take on the issues of climate change because if they're feeling it, and they're being willing to do more progressive things. But if you're not feeling, summer's supposed to be hot, isn't it? Well, not this hot. But they're like, I don't care, I'm getting a tan. But it won't be till the first day they go out there and the tires on their cars are literally melting, where people are gonna say, well, we probably should do something about this. So I think seeing those things, touching those, and it was so much, and I'll end with this. The idea that a fire in San Francisco and in Los Angeles created the sky orange in Boston, that made people say something's afoot here, and differently than us just telling them that there's climate change. So again, if they can see that's going to help something that they're dealing with right now, say yes. But if not, I think we're going to be riding in cars for a long time.
Thank you, Mary. Yeah, it is interesting what has radically changed and what hasn't, and why. Godwin?
Yeah. But I am, attuned to, taking it in an incremental way. I don't want to go too radical, but I must say, with the lessons that COVID has shown us, there are some areas that we have to be radical. So here's my my perspective. If we are talking about, COVID coming, and with lockdown cities, populations have become so disenfranchised. Others have developed mistrust towards authorities because they look at them as enemies of progress. So now you're coming back to them and saying, we want to deliver services to you. There's no way they're going to take that with open hands. So there's already that challenge of mistrust created. For you to inch away, to kind of dig into that mistrust and alleviate it, it's going to take time. So that's going to be an incremental process. There are several people who are going to participate in this, the community, and we have to also underscore the importance of civil society here, because they can be the bridging ground here. They can be the middleman between communities that show mistrust to local authorities to help pacify, the animosity. So that's where I am looking at it from, the process of building trust, dialogue, and so on. It's going to be incremental. Resources, I am not sure we're going to get 100% of the resources that we need to address the vulnerabilities that COVID has made so clear in urban areas overnight. So that can never be a radical change, but it's an incremental thing. So we have to begin prioritizing. Where do we want to invest? Where do we want our dollar to go? We have $10. Where do we put 5? Where do we put 2? And so on. So that's an incremental process. It's going to take time. But if we are conscious, if we are aware of where we want to invest during our planning services, 5, 6, 7 years down the road, we're going to see that change that we need. It's totally unacceptable. Health is a human right. It's unacceptable for us to see children missing basic health services like vaccines. If they're not getting vaccinated, chances are those mothers will not get skilled care during childbirth. So they're likely to die during childbirth. Chances are these kids will not even go to school, let alone what the mayor said already, that, we're doing remote learning. Some people have access to remote learning. Poor families will not have access to that. So if they're missing basic things like vaccination. A child misses their routine vaccination, the initial doses. We know they will not have access to even clean water eventually down the road, and this child's future is doomed. So if we want them to access these services, then it begins, from what is impairing the access to these services. Is it at the decision level at homes? We have to understand that. Is it on their way to the facility? We have to understand that. Is it at the facility itself? Where in some countries we're having challenges with, um, people come to the facilities, the healthcare workers look at them differently. Those who drive in are served first, those who walk into the facility are served last. That type of differentiated approach to service delivery at the facility will make this caretaker not to come back. So is that challenge at the facility? Or is it an aftercare issue? After they access services, they have that bitter feeling, I wasn't treated well, or they're given a vaccine, they have an adverse event, and they feel it's not pleasant, I'm not going to take my kid back for vaccination. Are those the things that we want to address before we get a transformed or universal access to services? So that's why I'm looking at it from a point of incremental change to address vulnerabilities. Well, there are things that we will have to be radical with. The notion of looking at cities as biomedical hotspots, that we will need to come head on with and say, this is not the way we should do it. We will have to, break down our service delivery, make it more appropriate to the needs of our population. So there are radical changes we can make, but most of it will really have to be incremental. COVID really has shown us, what we can do and where and when.
Yeah, thank you for that very balanced message, Godwin. It's interesting that this pandemic has, caused a big organization like UNICEF to shift their priorities. So, of course, there's so many priorities that you're dealing with, but this seems like it's kind of a wake-up call that is causing you to incrementally change in a better direction. So yeah, finally over to Sam.
So I think it's a really tough question. Again, living in Vietnam, we had a first wave in January, February, through March and April. And during that first wave, we had, a few hundred cases, no deaths. We had about 3 to 4 weeks of pretty tight lockdown to end that wave. Then we had no cases for 3.5 months, and then we had a mini second wave. It was big for here, but a few hundred additional cases. Unfortunately, our first deaths, there's been about 30, 35 deaths now. This is in a country of almost 100 million people right next door to China, by the way. So it's pretty impressive. And now, they've gotten things back under control. No community transmission for the last over a month, I think. What has been really interesting here is that because the government has done such a good job, and I think really needs to be commended, it's been amazing how well they've handled this pandemic. But the paradox is because they've done it so well, there is very little pressure for radical change. It is amazing how quickly life went back to normal and how quickly people wanted life to go back to normal. And how little, in other cities, I feel like people have taken this as an opportunity to really question and think about some fundamental shifts and changes. In Vietnam, paradoxically, because we've been able to go back to a relatively normal lifestyle, there really hasn't been this push for a radical rethink. So I think it's going to depend a lot about where you are. Different cities are going to experience this differently. But there is there will, I think, everywhere be a strong pressure to go back to normal. I think it's a very natural and strong tendency. And of course, that, normal may look good for certain people, and maybe that normal was never really great for certain other people. And so I think we should be, on the one hand, yes, we're all hoping that a vaccine will come. And by the way, even with the vaccine, that's not going to be a silver bullet. It's going to take a long time. But I think a lot of people are hoping when the vaccine comes, we can all go back to life the way it was before COVID. And I think there are some things about life before COVID that everyone will be thrilled. All of us are thrilled. We'll be thrilled to have back. But I think we should also be critical in thinking about maybe there are certain things that we don't want to go back to the way things were before. If I have to think about like the one radical change, and I realize it's interesting that this was not a deliberate thing, but we ended up having a manel here, and I do think that one thing that we've seen with this epidemic is the gendered impact of this epidemic. That COVID-19 has affected men and women very differently. It's affected men and women in urban environments very differently because of the impact it's had on childcare and children's education, because of the fact that many women are in these essential worker categories that have been seriously affected, either because they're in the health workforce or because they're in informal livelihoods that have been really badly hit by this. So I think the pandemic has shown us that many of our cities really have not been great cities for women, and I think that I think it does call for us to radically rethink from a whole range of things. I can't could go on for very long, so I won't belabor the point, but I think we've learned a lot about how our cities are failing women, and how when these crises come, the burden and the impact of that falls very unequally between men and women. And I think that could be something that we could dare to be radical about, and to think about how can we reshape our urban systems, our service provision, childcare, support for informal workers, support for these workforce, certain categories of our workforce that are highly female dominated and that really receive the worst benefits, the least support, the lowest salaries. We could talk about the issue of domestic violence, which has always been there, but there's been an epidemic of increased domestic violence that we've seen unfortunately unfolding. So that would be maybe the one area that I think we could be radical in thinking about it. And I also think we can dare to be radical because it's not something that only, it will require resources and changes in resources, investing in certain services and investing in certain livelihoods and stuff like that. But I think there's also a lot of social and cultural and behavioral changes that it prompts us to make that are things that we can already start doing even with limited resources. So I would just put that as maybe a radical idea for how cities, how we can be thinking differently about cities.
Yeah, so thanks, Sam, and thanks for the rest of the panelists. I think that the mayor's analogy to climate change is really interesting, because it's not one of these big existential threats, and in some cases it has been successful in nudging people towards behavior change, and in some cases not. And how is this going to be different? I'm not going to stay here too much long because you guys have been doing a really good job explaining your point yourself, and we're just going to jump into the kind of the lightning round of the fourth topic. If you can keep your responses to 2 or 3 minutes, that would be great, and then we'll take some audience questions. So, in conclusion, from our questions is, what is critical to mobilizing political, institutional, financial, and social capital to respond to COVID-19 and put cities on a more inclusive development pathway? Mr. Mayor?
Can you read it again? I didn't get that first part of it.
Yeah, sure. What is critical to mobilizing political, institutional, financial, and social capital to respond to COVID-19 and put cities on a more inclusive development pathway?
I mean, I think what we learned through this whole thing is that people do have a lot of power, and that the institutions will respond to them if put the right pressure. The murder of George Floyd showed that. I think the spotlight of the absence of Black women in power positions and powerful positions to make decisions for communities has shown that, and I think there's a slew of new positions being put in, with Black women being put in the rightful places of power. Just yesterday, the governor of Massachusetts, put the Supreme Judicial Court of Massachusetts, the head justice is now a woman, of a Black woman. I think that people need to know that it matters that you demonstrate your individual power. The bad thing is that they are very powerful too. That if they don't do it, we can keep going down this race. So I say that to excite you that you have all this power, so that if you wear a mask and you social distance, you have the power to kill this virus. And it's, again, the people with the least the most to lose are the ones that are saying, well, what does it really matter? Because I'm here to tell you, rich people are hiding out. They're not going to be in public spaces. They're not having you over their house for dinner. And so you have to do that. Exude your power. We have to make sure people know that they have the incredible power to kill this. The reason why we stopped the curve in most communities because we just stayed home. Such a simple thing but we had the power to stop we had the power to change the environmental landscape. I don't know if you saw those pictures of Venice. Venice, the water was blue. Dolphins were in it. In places that we hadn't seen wild animals that were coming out, places that stuff hadn't grown before, because we weren't in the environment. We had the power to change those things. So we do have the power to demand from our elected officials and policymakers that they do the right thing. But we also have the power to stop this. But we can't do anything until we stop this virus. So and my new saying to people is, if you want to celebrate your birthday next year, you got to get through this year. And so you can't get through this year, so you got to not celebrate your birthday. I turned 50 this year, and I had a shindig. We were going to go big. We're going to go small. And I'm going to, thank, my stars that I got another year, and that we'll celebrate next year. But we are down. This is the most important. We are powerful against this individually. Individually, we're powerful against this virus. And what we've seen is, if we exert our individual powers as well, to tell policymakers that we need to change these policies, that they'll listen to. And that's not just voting. That's not just voting. That's like voting and then showing up.
We have two vaccine specialists also on the panel. I hope that we can have a birthday party for you next year. We'll see. Godwin, your response.
Yeah, so it's critical that we engage everyone in cities if we want to see that development. Without that, with vertical programs, vertical thinking, planning, very fragmented development initiatives, we are not going to see development in urban areas. And yes, with COVID, we've seen it. I alluded to that in the previous discussion, why partnership is important, leveraging the importance or the strength of every partner. We're just not saying partnership for the sake of it. We're saying it because we want the strength of every individual, group, entity in urban area should be leveraged, so that we can bring those together to build a coalition that would be resilient, make the city resilient to respond to future shocks that might come. This is not going to be the last pandemic. This is not going to be the last event, or even, natural disasters occur. We have fires that are coming by, flooding in some areas, and so on. So we have to prepare cities for eventualities that will happen in the future, just beyond this pandemic. The second thing is we have to look at data. Data can inform both our planning for financing cities, for social change. If we want to build institutions that will respond to shocks in the future, you need data to inform you on where your investments or your priorities are. So data systems, how we build that, we can use existing data structures to improve on, make it more disaggregated for urban areas, make it more pointing, capture relevant information. We're capturing information, yes, but we're not capturing probably the critical information that we need. So we have to be very intentional in what we want to collect for planning, investment, information, and so on. So that would be my other point. The other one is build trust. They want build trust in cities. Let everyone in city feel that they are part of the solution, not part of the problem. Yes, if you're part of the problem, then become part of the solution. But if we have that segregation still happening, where a group is excluded from decision making, and then trust will never come into this inclusive development pathway for cities. So let's build a trust, and the only way we can build trust is remove actions that will show that certain parts of the city do not really belong to the city, and we see that happening. The slums are being destroyed in places like Lagos and so on. So let's build a trust. I'll close with that.
Great, thank you. And finally, Sam?
Yeah, really quickly, I'd love to get to the audience questions as well. And again, thanks to the co-panelists, really great reflections. I think I would say, look, it's been really interesting to be in Vietnam during this pandemic, and maybe a couple of examples. So we did have a lockdown period that was really economically tough for a lot of people here, and what was interesting was the government deployed a lot of measures and tried to support people, but a lot of the things that seemed to be most remarkable were things that actually came from the community themselves. So there was some coverage of a businessman who set up a rice ATM, and the nice thing about this rice ATM was you didn't have to put money in. Just anyone who needed rice, who was having trouble making ends meet, could go, and it would just give you up to 2 kilos of rice per person. And he started it off just with whatever he could do, and then a lot of other people donated.
The first question we had was about decentralization. So how the funding mechanisms of national versus city governments are working in this pandemic. And I think this is kind of an interesting panel because we have an urban consultant, an intergovernmental organization, and a mayor. So what has been successful in terms of self-funding or having funds be more decentralized and decision-making decentralized to cities during this pandemic?
I don't know. I mean, for me, it's been a little bit of a problem because you can't have 17 flavors on attacking this virus. There's either the right way or the wrong way, and I don't want that. I remember actually watching when they were rolling out the stuff on what we have to do to fight the virus, and the end of every sentence was, "We're going to leave it to the municipality to enforce it." And I thought, and the list of people, I am probably the least resourced to enforce it. And then people, to them, it's easy for them to question my authority because I'm so close to them. Familiarity breeds contempt, and so they know I'm not a disease specialist, so they're like, what is Dan doing? So I worry a little bit about that. But I got to make a plug. Government is the stuff we do together that we can't do individually, and so government should be where we come to do these big things. It should be central. I can't build roads, and I can't build hospitals, and I can't move markets to help people. I just can't do those things. So I worry, again, who has the most to lose in a decentralized situation is those in the poorest situations. And you can't elect somebody. Poor people can't elect somebody to a government that doesn't exist. So now poor people can elect representatives to a body that can make them move stuff for them. So I think that the decentralization, at least in the United States, has been a problem. Early on, it was a resource problem. If you think about N95 masks and ventilators, the federal government was kind of like caught on their heels and all that stuff. So if the state governments had to go around and they were paying high dollar for it, and some of them were getting hijacked and stuff on their money, and it shouldn't be like that. And again, when it works right, it's supposed to be the stuff we do together that we can't do individually. And I'm glad to have had the power. I'm not really sure I had the means, but it did make it seem like we're giving people choices. But in a pandemic, I'm not sure the choices are the right way to go on fighting the virus, and I think it was a problem.
Yeah, so that's a bunch of really good points.
Maybe just
you guys want to jump in?
Yeah, maybe just a quick reaction. So I think that when it comes to public health, I think it's pretty clear. I mean, if we look at the countries that have been more successful and the places that have been less successful, obviously there are always exceptions to the rule, but I think having a standard set of policies and kind of a strong national policy making that's been focused on public health, I think is really critical. And so that's where I think, I agree with the mayor completely. You actually need, for public health, often kind of centralized approaches are important to have those norms and policies and the technical support that you need from that national level. But when it comes to the economic response, when it comes to dealing with the economic consequences that come with something like this, that's where I actually think that some of these big government centralized schemes haven't been as good and targeted and appropriate as maybe things could have been if cities and communities had more resources that were pushed down to their level. I know, for example, in many developing world countries, the national government doesn't really have a great idea of where the urban poor are and who they are and what their needs really are. But if you go to the neighborhood council committee, they know. Actually, people know. People in the community know who needs the help, what kind of help they need, whatever. Obviously, you got to be careful. You got to be careful of the local political dynamics. Make sure no one's going to get excluded or all of that. But in general, I think that for the economic response, I think in many places there are some countries where the central government said, you know what, we're going to give resources to the cities and let the cities figure out how to do the economic response, and that I think has been in some places a good model, which is different from the public health response, where I totally agree that you kind of need a more centralized, standardized approach.
Yeah, good point. Gladwin, did you want to jump in, or should we just?
Yeah, I think the advantages of decentralization is first, it brings the resources closer to where the decisions or the needs are, which is acceptable. But if you're looking at setting norms and standards, say, okay, COVID vaccine is coming up, and you're looking at procuring vaccine for the nation. It might not be of advantage to decentralize that decision to the cities. That is something that you need to make at the central level before, so that you procure and then you can disseminate downwards. So there are ups and downs, but I think if you want to make the processes shorter, decisions quicker, disperse resources, you might go decentralization. But if you want to maintain the norms and standards and have response that adhere to certain norms, I think we might need to keep it central.
So the other thing really quickly that I see is in many countries it's very popular. So there's this wave of people saying decentralization is good. I think that's been a political tendency over 20 years or so. And I think a lot of times national governments are very good at saying, oh, great, we're going to decentralize the responsibility to provide health, education, and all these basic services. We'll let the cities do that, but we're not going to decentralize the money, right? So they end up giving you the responsibility and saying, oh, you can do all the work, but in fact, they don't give you the resources that you need as a city to actually do that. So that's, I think, if you're going to do decentralization, you got to decentralize the resources as well. Otherwise, it just doesn't work.
But think about the example, and think about the example that you talked about. I'm fascinated by the rice ATM, right? A good mayor would say, I'm going to put I want to put a rice ATM on every corner. It's like, it's a granular thought that you can expand, but you can't do that unless you have a centralized power there. Like, you know, a good regional governor could be like, hey, we're gonna get everybody a rice ATM, and then you don't have to wait because there's a decision and there's a process and a way to get that money to folks. But I do agree with you. A lot of responsibility, very few money.
Yeah. So unfortunately, we have to wrap up there. As much as I'd like to keep on going and you know, getting more questions in front of you guys, this will be up in public, and so we can share it. And I would just like to conclude by again thanking Stantec for hosting this and for these three wonderful panelists who joined us. I really enjoyed today's conversation and definitely got a lot of food for thought. So thank you.
Thanks a lot.
Thank you, guys.
Take care, guys. Thank you.
Take care.
Yeah.
Bye.
Thank you.
Bye.